Hello, everyone, and welcome. My name is Nicolas Rondeau-Lapierre, and I'm the General Manager of the Canadian Association of Nuclear Medicine. Thank you very much for being here today. It's our first conference since the pandemic back in Quebec. I think in 2019 was the last edition. We're quite happy to have you all here today. It was a lot of effort to put this together. But we're getting very nice comments about the fact that we can be back together without mask, social distancing. So please feel free to come and talk to colleagues, come talk to us. It's been a couple of years, and I think it's going to do some good to have finally human contact after so long of being with the pandemic. Today is, I'm very excited to present what today is going to be. Today is the Radiopharmacy review course. We have a nice program for all of you today. We do have attendee online too, so thank you for joining also. We have two co-chair of the session today. One of them is Dr. Ginge, and she's in Toronto. She was supposed to be here. Unfortunately, she couldn't. And she would like to introduce the other co-chair, which is Dr. Abrams. So I'll give Dr. Ginge the floor here to do a small introduction, and then we'll just go ahead with the session. Thank you very much again for everyone for being here, and enjoy today.
Thank you, Nicolas. Good morning, everyone. Bonjour à tous. My name is Mihaela Gunj. I work in Toronto as a radiopharmacist, and it's my pleasure to welcome you all to the second edition of the Radiopharmacy course as part of the CANM annual conference. As Nicolas said, this was 2 years in the making for the opportunity to have it in person, but then again, look where I am. Nevertheless, we gathered for you la crème de la crème of the radiopharmaceutical scientists in Canada to present a concentrated synopsis of the main concepts in radiopharmacy. And I'd like to put on a disclaimer that radiopharmaceutical scientists, chemists, radiopharmacists are not part of the panel that formulates the questions for the Royal College exam, but we try our best to take your feedback and include it in this course. And I suggest to use the two Q&A sessions, the AM session before lunch and the PM session at the end of this course to put forward your questions that you may have. On this, I would like to introduce you my co-chair and actually the main chair of this course, Dr. Doug Abrams. And for those of you who don't know him, please come out of isolation. He is a national treasure in radiopharmaceutical sciences and nuclear medicine in Canada. A little bit about him. Doug graduated from the University of Alberta in Edmonton. He had a fellowship at the German Cancer Research Institute in Heidelberg. And afterwards, he's done a postdoctoral fellowship at the Cross Cancer Institute in Edmonton. Afterwards, he moved to Winnipeg to become assistant director of the Winnipeg Health Sciences Radiopharmacy. And then he came back to Edmonton to become the director of Edmonton Radiopharmaceutical Center. In 2014, he joined Eastern Health as a consultant to help set up the Newfoundland and Labrador Center for Molecular Imaging and Research. His research interests are in radiopharmaceutical development and translation of patent-spec radiopharmaceuticals into diagnostic and therapeutic use. As I mentioned, Dr. Abrams is a pillar in our community here, involved in several national and international professional organizations. He has been president of CARS, the Canadian Association of Radiopharmaceutical Scientists, Society of Nuclear Medicine, Prairie Provinces Chapter, Canadian Society of Nuclear Medicine, and founding president of the Canadian College of Radiopharmaceutical Scientists. He's also a member of the Nuclear Medicine Alliance and has served on SNMMI Radiopharmaceutical Sciences organizing committee. He was a member of Health Canada Regulatory Group on Medical Isotopes and helped coordinate the last several Health Canada regulatory workshops. And most recently, he helped found the bilateral Health Canada CNM CARS Regulatory Consultative Group, meant to liaise with Health Canada on regulatory matters of interest to the nuclear medicine community. As I said, a pillar of our nuclear medicine community here in Canada. My pleasure to introduce Dr. Doug Abrams.
Thank you so much, Mihaela. Very kind words and an awful lot of them, so that's unfortunate. It's Mihaela and my pleasure to host this. This is delayed from about 2020, I think. So it's so nice to see everybody in person, like Nick said. This is the course that we're having this morning. It's a little bit changed, probably from what you saw prior. We've decided to have some question periods at the end of the morning and the end of the afternoon. We have 3 virtual speakers, so it'll be a lot easier if we do that. All of the speakers have been asked to leave a little bit of time at the end of their talks for questions, but as you know, all speakers go well over their limit. So I think that with respect to questions, if we have enough time, we will take questions at the end of each presentation, but we'll also do questions right at the end. And at the end of the day, I think we have a fair bit of time for that. So this is the morning. I won't go through it except to say that I will give the introduction talk, and then I'll move right on into radionuclide production. We'll have Esther from Vancouver will give the talk on GMP, and then we'll have Humphrey from Saskatoon to give the talk on the SPECT radiopharmaceuticals, mostly the technetium area. And then in the afternoon, we'll have Mihaela, Jan, and Svetlana giving talks on the second part of SPECT tracers, non-technetium, PET tracers, and therapeutic radiopharmaceuticals. Even though we have a whole day, it's amazing how difficult it is to put everything we wanted to talk about into one day. So please get your questions, and we'll see if we can answer them. Okay, so introduction. Well, I like to start a lot of my talks just by talking about the history of nuclear medicine, and I won't say too much. There's many milestones, but I'm always impressed, and especially now, that 100 years ago, nuclear medicine could be said to have been born. So we have de Hevesy with his lead, and that's all famous. You all know that. Then we had the X-rays, but amazingly, in the 1930s, that's when the first cyclotron was used to produce P32. So I think that's pretty amazing. And not only that, Hamilton Stone worked with sodium-24 to treat leukemia patients. So even the therapy, which is becoming slowly becoming a real mainstay of nuclear medicine, was actually started. And of course, nuclear medicine would not be here if we did not have the discovery of technetium-99m. If we follow that a little bit further, and we see that we have the Anger camera and the generator for technetium, and those follow up on a technetium as I think the mainstays. Again, nuclear medicine wouldn't be here, I don't believe, without that. And that was the kits really had nuclear medicine come through, because at the time making technetium radiopharmaceuticals really took a lot of talent, and it took a lot of time, and the kit formation allowed a kind of a mass production and an easy production of radiopharmaceuticals. And then again, in the 1970s, we have the PET scanner and the instant kits. And then we have in the 1980s, we started to be more specific. We had receptor agents, neuroreceptor agents for PET and for SPECT. And then peptides, I don't know if you remember, but in the 1970s and 1980s, antibodies were going to be the silver bullet. And that still hasn't quite come to fruition, but we're still working on it. But now with the peptides, we're starting to move in that direction. And then in the 2010s, we have the amyloid imaging agents, prostate imaging agents, and moving along with therapy agents. I think the amyloid imaging and neuroimaging is going to become a big part of nuclear medicine in the future. And of course, the 2020s, that's you guys. So what's the definition of a radiopharmaceutical? Sorry, I'm so short I have to move over here. So hopefully you can hear me. This one here? Good plan. Is this on? There we go. There we go. Oh, now I feel like a MC at a whole show. Okay, can you guys hear me? Perfect. Okay, so the definition of a radiopharmaceutical, there's a whole bunch. You've seen them all, but really it's just a radioactive compound, and it's used for diagnosis and therapeutic purposes. I'll go through, everybody knows all this, but I think it's nice to lead into all the other talks. Radiopharmaceutical really is a combination of two things, a radionuclide and a ligand or a pharmaceutical piece. The radionuclide can be the radiopharmaceutical itself, or it can just be a tag that's labeled onto it. Depending on the choice of the radionuclide, it can be diagnostic or it can be therapeutic. And we'll go through, all our speakers will go through that in more detail, depending on what they're talking about. So the pharmaceutical guides the radio label, and it can be either a chemical or a biological or a particulate. So a radionuclide is an atom that has excessive nuclear energy and makes it unstable. I'll be talking about radionuclide production a little bit later on, and we'll go into that in a little bit more depth. So let's start about really basic and the atomic structure. I'll talk about this a little bit later on as well, but the important part to understand is that the nucleus is made up of protons and neutrons, and the neutrons act as glue, and they hold the nucleus together. And the protons also determine the atomic number and determine the element. So when I talk about the production, this becomes very important on how you select your production technique for producing radioisotopes. So the relationship is given here. Now, you have isotopes are of the same element and of the same proton. People use isotopes interchangeably with radionuclides and radioisotopes. They're not quite the same, but for general purposes, it works. But isotones are different elements with the same number of neutrons, and these are important because this is what we'll be doing. We'll be changing different products, different elements from one to the other. Decay mechanisms. So the radioactive decay, everybody's familiar with the Segre plot, and you can see that it's not a linear relationship, but it tends to be curved. As the elements get bigger and bigger, they need more neutrons in the atom to stabilize the nucleus and keep it stable. As the elements get very, very large, they become very, very complex. And we will see that working with small radioisotopes or radionuclides is much easier than when you get to the larger isotopes. There's a difference in the ease of use, and especially in the therapy when we get into the alpha emitters and things like that. It's the chemistry becomes very, very difficult and very, very interesting. Radioactive decay, as you're all familiar with this, we see all the different types of radioactive decay. Svetlana will be talking about therapy. Jan and Humphrey will be, and Mihaela will be talking about the other types of emitting radionuclides. So what are the important characteristics of medical radionuclides? First of all, half-life. We tend to split these up. You tend to want to use shorter half-life for diagnostic agents and longer half-lives for therapeutic agents. The emissions, again, photons for diagnostic, particles for therapeutic. And this will be talked about a little bit later on in a bit more detail. The gamma energy, you want it high enough to escape without tissue interaction, greater than 100 keV. This is where technetium 99M was looked at a long time ago, and people said, this is a really nice isotope because of the emission characteristic and the half-life. And then they looked at the chemistry and said, well, this isn't such a nice isotope because it's an awful lot of work to get this labeled onto a product. Then, of course, the other properties are more practical, the availability of the production methods. And I'll be going through generators, cyclotrons, and reactors, et cetera, for the balance. So all of that really leads to this, is where we balance the properties between the radionuclide characteristics, between the image quality and the radiation dose. And of course, all of that comes together with effective half-life. And so your radiopharmaceutical can be designed around that. And I think there'll be a little bit of discussion on the design of radiopharmaceuticals as we get further on. So all medical radionuclides are artificial, and I'll go through that in a lot more detail a little later on. The characteristics of the ideal radiopharmaceutical take up three different main areas: physical, chemical, and the biological. The physical is the availability, physical half-life, particle emission, and what type of decay it has. Chemical and biological refer more to the radiopharmaceutical, and again, we have a dosage form, sterility and apyrogenicity, metabolic stability, effective half-life, and target to non-target ratio. The properties of the ligand determine the biodistribution and the kinetics. So the localization or biodistribution determines the indication. You can turn that around and say, well, the indication would say what the localization of biodistribution would be. Some radiopharmaceuticals actually at the beginning sort of, they decided what you were going to look at them after they injected. And they said, oh, look what it had, look what it does. But now most radiopharmaceuticals are designed for a specific purpose. Metabolism determines the effective half-life, affects the radiation dose. The excretion determines again the effective half-life and affects the radiation dose. Toxicity, all radiopharmaceuticals are injected at a very, very low dose, but even still, toxicity can have an effect on the physiology, and we don't want to perturb that. And same thing with pharmacological effect. Some of the peptides and different molecules work on extremely small concentrations, and they actually will have a physiological effect. And so we need to work on very small doses. Thankfully, radiopharmaceuticals tend to be synthesized and injected in very small doses. So this is usually not a problem, but we have had things in the past that have caused some problems with toxicity. General considerations on radiopharmaceutical design. The diagnostic information required, for example, blood flow status, metabolic status, organ function, presence of receptors. You need, when you're to think about how do you want to administer this radiopharmaceutical, what's the mechanism of localization? Will have an effect on the administration route, and how is it cleared, and how fast is it cleared, and is the clearance useful, or is it something that you want to slow down? Determine the complexity and preparing. That's something, the first two are sort of things that the physicians, you guys will tell us that you need, but the other part we'll come back and say, well, we can do it or we can't do it because of the complexity with the radiochemical labeling, the stability and the solubility of the products we're looking at, the half-life and the production method, and the availability, et cetera, of the products. And of course, the diagnostic therapeutic benefits versus the adverse effects, structure-activity relationships, and toxicity. So all those things need to be taken into consideration. In a little bit more detail, we need to look at the different types of reactions and the solubilities, the reaction conditions, the half-lives. When you're looking at the chemistry, the stoichiometry, what's the specific activity you need? That depends on what you're looking at. The size of the molecule, it'll affect the biodistribution of formulation. Molecular charge and solubility, again, will affect biodistribution and formulation. Protein binding and solubility, chemical and radiochemical stability, and the pharmacokinetics and biodistribution. Mechanism of localization, you're all familiar with this, and I just kind of in this slide, Hale and I have put together the major localization mechanisms and examples of the radiopharmaceuticals that localize by this mechanism. Radio labeling methods, we'll be talking about these in a little bit more detail, but these are the general ones. Isotopic exchange reactions for MIBG, I-123 and I-131. Introduction of a foreign label, fluorine 18, FDG is an example of that. Radionuclide ligand exchange or transchelation. That's technetium radiochemistry is a good example of that. Bifunctional chelating agents, gallium, and some of our therapeutic radiopharmaceuticals now. Biosynthesis and recoil labeling are things that we are interesting in the research phenomenon that don't tend to be clinically useful. And lastly, chemical synthesis, something like F-DOPA. Those are, I separate those from some of the introduction of a foreign label, and those are very complex reactions to form molecules that are a little bit more difficult to make. One of the big things on radiopharmaceutical sciences is quality assurance, and Esther is going to be talking about this a little bit later on. And everything follows the USP. I won't go into it in too much detail. But the factors affecting quality start at the facility, and we bring this in and we talk about this in some detail because it has affected our per production and all of the cyclotron facilities and the way nuclear medicine is going. The regulations continue to be a moving target, and we continue to need to educate everyone involved in nuclear medicine and radiopharmacy on the regulations, on facility needs. We need to talk to the administration about quality management, getting people in place to run these things, and facility management, having the proper facility to work on these things. And Esther will give us a more detailed overview of that. Quality control, not to be confused with quality assurance. Physical chemical tests, visual appearance, pH, ionic strength, chemical purity. Go through those in a little bit of detail. We look at the color, the clarity, that can tell you. Just have a little vial of antimony sulfide. Anybody who's seen antimony sulfide realizes that that may not be very good antimony sulfide. Clarity, particulate size, particulate number, good example for, whoops, there we go, wrong button. For a macro aggregate. pH, stability, effect stability, can have a physiological effect, same with ionic strength. These are usually determined by paper, pH by paper or pH meter, depending on the volume, and ionic strength osmometer. People don't do as much ionic strength anymore. That was an FDG requirement many, many years ago, and now generally isn't required. Chemical purity is always important, and this is something that is determined really not in the radiopharmacy, but a little bit earlier on in the production techniques. But the sources, we can have problems. You can have radiochemical purity problems outside of the manufacturing source through labeling, breakdown of the compound, etc. Consequences: you can have interference with the diagnostic imaging, may have toxic effects. We'll go through some of the detection methods and the purification methods. We'll talk about those in a little while. Biological purity, this is really important. So we have sterility, apyrogenicity, and toxicity. Sterility is something that we can control right in the radiopharmacy. And pyrogens we can control, but it's something we can't really fix. So in sterility, you can autoclave something, you can filter it, and you can keep products sterile. We do that all the time, but you can't get rid of pyrogens very easily. And toxicity, of course, that's all determined in the development stage. This slide just shows some of the tests and the limits and how they're performed for sterility, pyrogens, and toxicity. Mihail and I were going to take these slides out, but then we felt that it was important that antibody peptides now, I think we're going to see more and more. That silver bullet from the 1970s may be rearing its ugly head, and we'll be doing more and more peptide work. So these are some of the quality control for peptides. They're a little bit different than normal radiopharmaceuticals. There's in vivo characterization, the blood clearance, because they're large molecules and they tend to bind to proteins, etc. They have in vivo stability. Some of the labeling techniques are difficult. For the therapeutics, it's important that they have very, very strong stability binding stability, so we don't lose the radio label. And radionuclidic purity, I'll talk about this a little bit further in radiation production, radionuclide production, that is. The generator impurities, I believe Humphrey's going to talk about this a little bit. And radiochemical purity, we'll talk about that a little bit later as well. But this is kind of a complex slide, but I think it's a nice slide. I don't know if you can see this very well. So the radiochemical purity actually can be affected by a lot of things: temperature, pH, light, oxidation reactions, reduction reactions, radiolysis, incomplete reaction. So we really have to keep all of our things controlled, and the analytical methods are here that we'll talk about a little bit. Storage conditions are important: shield from light and refrigerate, and then antioxidants to a lot of technetium compounds are added. How am I doing time-wise? Okay. The next couple of slides are really, really busy. And I think that this slide sort of talks about the basics of chromatography. And I think for nuclear medicine physicians, it's important to understand how the chromatography works. And so you understand how the TLC results or the HPLC results that you get and that you see derived. In classical chemistry, oh, I can hardly see that. In classical chemistry, you tend to choose things so that your product has an RF of 0.5. And then anything more polar than that will stay at the origin. Anything more lipophilic than that will move forward. And that's how we base all of our radiopharmaceutical QC. Actually, I'll go back for one sec. One of the things is that if you're doing a lot of TLC analyses, if you're making 20 or 30 radiopharmaceuticals in the morning, these very complex TLC methods don't work very well because it takes a lot of care. And so Technetium Radiopharmaceuticals developed what we call baseline resolution techniques, where you select the solvent and you select the adsorbent very, very specifically so that you can move your known impurities back and forth. I have a number of slides that go through that in more detail, and I won't talk about it in too much detail. I'll just say that your analytical strategy is based on selecting your adsorbent and selecting your solvent so that you balance the affinity for the products and the impurities. And here we have I have shown the solvent polarities and the absorption media affinities. Wrong button. There we go. Technically challenged here. Apologies for that. So here's for technetium radiopharmaceuticals. Won't go into a whole lot of detail on these. I'd like you to take a look at these slides. I think you all will have access to them. And essentially, PERT itself is very interesting because you can move PERT around all over the TLC plate by choosing your solvent appropriately and by choosing your adsorbent appropriately. And so there's some examples here, but essentially hydrophilic components in a polar organics, in a polar solvent will go to the origin. And if you use a hydrophobic solvent, they'll go to the, sorry, the opposite. If you use a hydrophobic solvent, they'll go to the origin. Can't read very well. And if you use an aqueous solvent, they'll go to the solvent front. So you can move things around. If you know what your impurities are that you're looking for, you can change your solvent. Same thing with the absorbent. You can choose something that is has a high affinity for your lipophilic compounds, or you can choose something that has a high affinity for your hydrophilic compounds, and that'll help you choose what your absorbents are. And for non-chelate radiopharmaceuticals, it's a little bit more difficult, but it's essentially the same idea. So getting into the radiopharmacy design and organization, for the nuclear pharmacy, it's a special area where we practice pharmacy and we do compounding and dispensing of radiopharmaceuticals. You'll see we have somebody dressed in a gown and system, and this is something that radiopharmaceuticals in the old, I have to say old days because I'm an old guy, were actually just prepared in labs, and we slowly moved to the situation where we have to do everything very, very sterile and pathogen free. So the mandate is to compound, dispense, and distribute radiopharmaceuticals, provide information and consultation, train students, and do research if possible. The premises, again, Esther will talk about this in a little bit more detail, but essentially we have two mandates, or two important mandates. We have the CNSC looking after the radiation safety, and we have GMP looking after the product. And the CNSC is worried about the safety of the worker, and Health Canada is worried about the safety of the product. Design considerations, you can go through this at your leisure, but essentially you need to restrict access because it's radioactive material being used, also sterile and pathogen free area, so you want to keep everything clean. And then of course you need logistics, etc., things like that. The components, as you just mentioned, you need clean room, suite, or facility. Most labs have a research area and have a QC area, storage for the radionuclides, and reception area and administration area. And lastly, we talk about the availability of radiopharmaceuticals. Again, Esther will touch on this just a little bit, but essentially most radiopharmaceuticals that are not approved in Canada right now need to go through either a CTA application, clinical trial, or through the special access program. And that'll be discussed in more detail later. So that was a very fast rundown for an introduction to the radiopharmacy. The reason that we did this introduction was to kind of give you an overview so that when the people were talking about their respective areas, they don't need to cover those things in detail again. So thank you for that. Any questions? That's a really interesting question. I can talk about that for an hour. The role of the single photon radiopharmaceuticals and radiopharmacies are theoretically under control of the provincial pharmaceutical associations. PET facilities and cyclotron facilities are under control of the federal government or Health Canada. So that's sort of the difference. Most places, most provinces, the pharmaceutical associations aren't overly involved. And I'm from Alberta, unfortunately. I don't know the Ontario College situation very well, but Mihaela might be able to elaborate on that. But my understanding is Ontario is a little bit more involved than some of the other provinces.
No, Mihaela here. Actually, the Ontario College of Pharmacists plan to be involved, but they're not involved yet.
Yes. My understanding is Ontario is the only province. I may be overstepping there, but it's one of the few provinces that actually has shown any interest in radiopharmaceutical governance. But right now they don't. Most provinces don't have very much involvement. So I think that if they wanted to, they could exert some influence. Most of the people in those bodies don't really have the knowledge, and they understand that, and so they don't sort of overstep their bounds. This is actually one of the reasons why PET radiopharmaceuticals were introduced way later in Canada than single photon, and yet the regulations are so much stronger because Health Canada has control over everything because they've deemed PET manufacture to be manufacturing, and single photons are deemed to be dispensing and compounding. So there's the difference. That's kind of an overview. Well, the USP, the N gamma reactions and areas of the USP that I think the different areas, I think Quebec actually is getting a bit more involved as well, now that I think about it. And I think that most radiopharmaceutical kits will need to be conducted under aseptic conditions, and the USP conditions are going to take over. Yep. Yeah, it's very nicely laid out in the USP, and I don't know if Esther will be able to get into that, but that would be some good questions for her. Okay. So how far behind am I? Oh. Okay. Okay. Well, unfortunately you're stuck with me for another hour, so that could be boring. Is my next one up, Eric? Oops. Let's get rid of that. Okay. Yeah. Radionuclide production. Ah, here we are. The reason that I mentioned everybody talks longer than they're supposed to is because I always talk longer than I'm supposed to. So that's why I said that, hoping that all the rest of the people follow suit in that. This is a talk on radionuclide production, and I thought, well, this will be easy to do in an hour. And of course, that's never true. So they got way more slides than I need to, so I'll zip through some of the slides. You guys have access to these things so you can take a look at them. And of course, we'll have lots of questions you can ask me about. But the radionuclide production is, I think, probably for you guys not terribly necessary, except to understand and have a good idea of where these radioisotopes come from and some of the problems we have in producing them. But in the end, it doesn't really matter. You get the isotope, you get the radionuclide, you get the radiopharmaceutical, and you use it. But in the end, I think it's worthwhile for you to have a look at this. So without further ado, we saw this slide. A radionuclide is an atom excess nuclear energy, making it unstable. And you saw this slide as well. And the important takeaway from this is obviously radionuclides are prepared by changing the number and the ratio of protons to neutrons. So And we went through this slide as well. Isotopes. Couple ways of making radionuclides is you can convert a stable isotope into a radioactive isotope, low specific activity. We tend to avoid that, but not always. But the other one that's easier or more important is to change to a different element. Okay, now I hope I can. Okay, this is a really nice encompassing slide, and it shows you the different nuclear reactions that I'll talk about. And we have the neutron reactions, we have proton reactions, and we have deuteron reactions. The most important ones essentially are these, and we will talk a little bit about photon reactions as well, just for interest's sake. But essentially, we have this is the target nuclide, and depending on your reaction, I think I'm dying here. Can you see anything on there? No. Okay. I don't have a pointer anymore. It doesn't look like. No, just dies. Okay, well, it doesn't really matter. Hopefully I can guide you through this a little bit better. But essentially, those are the reactions that we'll go through, and we'll talk about the different ways that we use them. So as I mentioned, all medical radionuclides are artificially produced. The nuclear reactor was one of the main production mechanisms, and then the cyclotron, and then your accelerator started to become more important as time went on. So fission nuclides. Do you have another pointer, Eric? No. Okay. Oh, it's working for a while. Maybe I wasn't pushing hard enough. Essentially, you've all seen this chart before. We have fission is sort of a bimodal process. Most of the products in here and on this side here are produced in about 6% yield. So moly's produced in about 6% yield, iodine is produced in about 6% yield, strontium-90 is produced in about 6% yield. And so we can separate all those isotopes out. It's a fair bit of work to separate the isotopes out from fission decay, but the yields are pretty good. And if the half-lives are long enough, this is how we get most of our radioisotopes. So. So there's a large number of reactor-produced isotopes that we get. I will talk about iodine-131, lutetium-177, and molybdenum-99 to give you examples. They all work a little bit differently. However, other than that, there's niche radionuclides that were or are used in nuclear medicine, and then there's research radionuclides. Many of them aim towards therapy, and Svetlana will be talking about those. So I-131 initially was used from fission product, but now the product that we get is actually a tellurium reaction. So we get a N-gamma reaction. An N-gamma reaction on tellurium converts to tellurium-131, which decays to iodine-131. That's a nice mechanism because we can separate it from the tellurium very, very easily by sublimation, and we get a very, very pure radionuclide because we can use a target that is enriched. Lutetium-177 is another reactor-produced radionuclide. There are the initial uses. The initial lutetium used was prepared using N-gamma reactions on lutetium-176. So you'll recognize that as a carrier-added reaction where we turn one isotope into another isotope. And the advantages of that is you have a very high reaction yield. You have about 1 milligram of starting material. yields about 57.4 gigabecq doses at end of production or end of synthesis for the lutetium, and it's a very simple chemical purification. The disadvantages, of course, is you have a very low specific activity, and approximately 30% of the lutetium about only 30% of the total lutetium load is 177 at end of bombardment. The other problem is that the neutron irradiation produces lutetium 177, and that's a longer lived contaminant, and it has some problems with storage and radiation dose. The second method of production is the no carrier added method, and you'll recognize this as we start out with ytterbium 176. It's an N-gamma reaction. It produces ytterbium 177, which decays to lutetium. So that's analogous to the ID 131 reaction, where you have two different elements, and you can separate those out, so you have a much higher specific activity. The disadvantages are essentially that you need to use enriched ytterbium 176, and this is quite expensive. The cross section is fairly low, so you need to use about a gram per irradiation, not meters. You don't need 1,000 meters. You need 1,000 milligrams of product. It's quite expensive. And currently, it comes from Russia, although I think there are other places looking into making that as well. And the separation and purification, even though you're separating two different chemicals, ytterbium from lutetium, it is a little bit more complex. There's no known charged particle method of production. The problem is that if you look at this excerpt from the periodic table, you'll see that there's nothing around lutetium besides ytterbium and hafnium, and there's no charged particle mechanism of converting those into lutetium. So we can't do it on a cyclotron, which would make it a little bit, which would give us maybe a few more routes, but there aren't any. Current supply, there is a concern over supply constraints. For lutetium, I read a paper that stated that lutetium Lutathera alone uses around 15,000 7.4 gigabecq doses a day as of 2020, and the overall annual usage is probably significantly higher than that, because that's just looking at one product. So we have supply constraints. One of the interesting things is that the Bruce Power Plant in Ontario, as of June of this year, came online, and they have an international collaboration between Bruce Power, Isogen, and ITM to produce lutetium. So the project still needs to be commissioned and receive CNSC approval, but it's nice to see that Canada's getting into the mix, because if you look here, we saw Canada got out of the mix when we started making moly quite a long time ago. So that was quite disappointing, actually. So moly is still generally produced through the fission products and separation from fission products. There's some details here about the radiation. The moly is generally used. Targets are irradiated for 6 days, and you get a pretty high, as I said, about 6% fission yield. And then the targets are moved over into different facilities to be processed so that the generator manufacturers can have that. I won't go into too much detail about that. I'm going to talk about some other production methods and talk a little bit about the moly supply chain in Canada. This is the old moly supply, except for the 2009, 2010, and things have changed considerably since then. In the NRU stopped producing medical isotopes in 2016, was still capable up until about 2018, but I don't believe they actually have the facilities to produce moly anymore operating. All of the reactors as of about 2010, I believe the slide's about 2010, are around 50 years old, so they're now even older than that. However, there's been a lot of work after the 2009, 2010 problems with the moly production, and a lot of reactors are coming online. If you want to read more about this, there's a very nice reference right on the bottom that talks about the capacity for 2019 to 2024. It's a high-level group on security of supply of medical radionuclides, and it talks about things specifically talks about the current processors and when they're going to be commissioned or when they're going to be decommissioned. And the potential irradiators entering in the period 2019 to 2024. So the article is probably dated to about 2018. It's published in 2019. Since then, we've seen the German reactor approved in August 2022. The French reactor, the Jules Horowitz, commissioned in 2021. Should have started up by now. I didn't actually find any evidence on whether it actually started up or not. The Murr reactor was approved for moly-99 production in 2021, and the Darlington reactor in Ontario was approved for preliminary testing in July 2022. So just over the last 2 years, we've seen quite a influx of reactor production of moly, which makes some of the work that a lot of well, I shouldn't say a lot of us, some of us in the room worked on a little bit remiss. Since 2010, a lot of work has gone into making moly using different methods, and I'm just going to list these here and not go into huge detail about them. But the first one, the most interesting ones are the N photon, or N-gamma, and gamma-N reactions. So the N-gamma reactions, these are non-fission reactions, and so they work on the interaction of neutrons with moly-98. This was actually one of the first mechanisms ever used to make moly-99 for a lot of reactors instead of using fission moly, because it's very easy to make, very easy to clean up, and if you don't have the facilities for cleaning up fission products, which is very complex, this is a good way to do it. The problem is you are an isotopic reaction where you're making moly-99 low specific activity, and so your generator system to separate your PERT is a little bit more difficult in doing. But North Star and BWXT are using this mechanism to make moly, and the BWXT purchased some of Nordion's facilities, and they're working with the Darlington plant. The gamma-N is a little bit different completely. It's a photon reaction where you react moly-100 with moly-99, and North Star has two projects, one using the gamma-N, N-gamma, and one using gamma-N. And the North Star has received FDA approval in one, and they're working very close to getting FDA approval with the other. And Saskatoon is the Canadian entrant into that system to make moly-100 using the gamma-N reaction, and they have produced moly. As far as I know, they haven't commercialized it, and I don't know where they are on that. There we go. So I'll just, I think it's interesting to know what Canada is doing. So they are using a linear accelerator to produce the gammas, and essentially the advantages of using this system are you have moly-100 and moly. 99. Yeah, it's a fairly low specific activity, but the advantages are you can use very thick targets, and you can get a very high flux of photons. It's very reliable, and there's very few reaction channels, so the product is very, very pure. So you end up with essentially Moly 99. The disadvantages are you've got lower cross sections, and it's difficult to produce no carrier-added radionuclides. And in this case, of course, you're stuck with the Moly 100 in the product. The target tree is such that actually if you maybe I can really quickly there, you can see there's a bunch of discs stacked over there, and essentially you radiate on one end, you take out the discs, you keep adding a new disc, and you move them out as you go along, and then after 6 days or so, this last disc is taken out and processed. And I want to talk about you have your Moly 99 in a very pure form. The problem is low specific activity, and so it has to be processed using specialized separation techniques. The cyclotron process, this we go into just Canada actually led the way on cyclotron. There's 2 groups that were set up, one in BC that kind of was led from BC, and there was another one, actually maybe they were both led from BC. One of them was led by the Advanced Cyclotron Systems and included the U of A in Sherbrooke, and the other one was led by Triumph UBC, and it was worked in Ontario with the Lawson and the Centre for Probe Development, CPDC. But again, it's sort of many cyclotron facilities were producing FDG with a 2-hour half-life and distributing that across the city and actually into quite long distances. And so with a 6-hour half-life, they felt that this process could follow the same route. And lastly, we have accelerator fission of U235. You'll see shine and pure. Neo-wave, these are very, very interesting reactions. You have a deuterium tritium you have deuterium impinging on tritium, making neutrons, and helium, which impinge, the neutrons impinge on U235, and you produce Moly. And so it doesn't use a nuclear reactor at all or a neutron source at all. It uses a deuterium source. This is being tested as an alternative supply. They have a supply agreement with Lantheus, and they have received some approval in the US, but as far as I know, they're not commercial yet. And Neo-wave is doing the same thing to make neutrons using a gamma N reaction again, like on Moly, but in this case they're using a lead bismuth target to produce a lot of neutrons, which then irradiate U235 and split Moly. The interesting thing about both these systems is the Moly separation occurs all in situ with the irradiation. Well, not really in situ, but they're liquid targets, and they cycle them through and separate out the Moly. Given the time it's taken to get all of these production techniques moving forward, and the reactors, the old reactors looking after themselves and starting to come online again, there's been one really doesn't know how important these alternate techniques will be. They have a lot of promise, but it's all economics, and whether they go forward or not, it's hard to say. Okay, so that was different mechanisms of using neutrons. And so now we're going to talk about charged particles. And most people think about charged particles as being cyclotrons, and nobody really, the use of linear accelerators in production of radionuclides is limited. So we'll talk about cyclotrons in this one here. So again, we have our little excerpt where we have the target radionuclide, and you can see the P reactions in there. Let's see if Oh, you guys can see that without me pointing it out. The nice advantage of the charged particle is that you have a larger selection of radionuclides that can be produced. And the radionuclides produced are usually of high specific activity or no carrier free. So most of them use targets and change the element. This is because you're able to control the particle type and the particle energy more efficiently. You also have somewhat more control over target material and time of irradiation than you do in a reactor, but that's depending on what type of mechanism you're using for your reactor. I won't talk about how cyclotron operates because Jan's going to tell us all about that. But I will just briefly show you a slide on the different radionuclides. We'll talk a little bit about fluorine, gallium, to give an idea of the different mechanisms and some of the complexities of making products on a cyclotron. These are the cross sections for the 4 low molecular weight radionuclides: carbon, nitrogen, oxygen, and fluorine. The nice thing you can see is that the energy that you require to reach saturation of your product is all available on low energy cyclotrons. And so that's really nice to see, because you don't need a big 30 or 70 MeV cyclotron to make these products. They're a little bit easier to operate. The chemistry of carbon, nitrogen, and oxygen are relatively straightforward, except for the fact that these things have very low, short, I should say, half-lives. And so the chemistry is straightforward, but you got to do it really quick. So fluorine 18 tended to be the one that people put a little bit more effort into. There's a bunch of reasons that fluorine works nicely, but one of the reasons I got into fluorine chemistry was we thought we got 2 hours to work rather than 2 seconds or 10 minutes or whatever that happens to be. But the chemistry of fluorine is much more interesting, and the production chemistry of fluorine is much more interesting. And we soon learned that doing fluorine chemistry was a totally different kettle of fish than doing carbon or oxygen chemistry or even nitrogen chemistry. Here's a target. I want to talk about this just a little bit because I'm not sure. I'm hoping Jan doesn't go into this too much, or he's shaking his head saying no, so I can talk about this. The reason I bring this up is actually related to the chemistry. You'll see that there's 2 reactions. There's an oxygen 18 PN reaction for making fluorine 18, and there's a neon 20 D alpha reaction for making fluorine 18. And when fluorine chemistry first came available, if you remember back, and why would you, to the first syntheses of FDG, the F2 reaction was a reaction that people were working with, and F2 is the fluorine gas, and you cannot recover fluorine gas from an aqueous target. And so if you look on the right hand side in the yellow there, we have the neon. I like about the iodine gas targets, and you irradiate those and you put a little bit of carrier fluorine F2 in there, and you exchange the fluorine as it's made, and then you take that fluorine gas, which is extremely corrosive and very nasty thing to work with, and only get a little bit out of your target, and all the rest of it sticks to everything else but your product. And you get very low yields, and their reactions are relatively complex. However, over the last number of years, probably 5 years ago, people stopped using the deuterium reactions at all because the chemistry for making all the products that required F2 gas disappeared, and people were able to use nucleophilic fluorine for that. So that changed life as we know it. I have a long set of slides on FDG chemistry showing the progression from F2 gas to fluoride gas, but Jan will talk about some of the pertinent aspects of that later on. This is a target for making fluoride. So essentially, we have a water target, and the schematic is on the left, and then the actual target's on the right. And if you can find the target in 5 seconds, then you win a prize. All the rest of that is just ancillary equipment to keep things cool and move things in and out. I've got niobium and HAVAR foils and niobium targets circled there. They tend to be the target materials of choice these days. I'll move forward into gallium, and I want to talk about cyclotron production of gallium. I'll talk about gallium generators later, but I think many of you are aware that gallium is becoming a very important radioisotope, and the production of gallium generators is still incomplete science. They're much better than they were even a couple of years ago, but they're still quite small, and a lot of people are looking to producing gallium-68 on a cyclotron. But again, it's sort of like fluorine-18, but it's a little bit more complicated because the half-life is a little bit shorter. So one of the things I want to show you on this slide, and I'll have a couple of other examples, is the complexity of producing isotopes on a cyclotron if you want to make them pure. If you're a physicist, you put targets in and you irradiate them and you look at what comes out and you go, okay, I know everything that's going on. If you're a chemist or a nuclear medicine physician, you look a little bit further and you see that you have impurities and you have complexity in separating, and you have complexity in the chemistry of the to use the product after you get out of the cyclotron. So here we have a slide that shows the proton energy and the gallium-68. So if we're looking at a zinc target, you'll notice that we have zinc-68 and targets, and then you have 3 different reactions, PN, P2N, P3N. I don't want to belabor this, I just want to show you that you end up with gallium-68, gallium-67, and gallium-68, depending on the energy of your incident proton. So it's very important that you select your targets and you select your energy because you don't want to produce gallium-67. Just an aside, I've never figured out why Health Canada has decided that you can inject gallium-68 alone, but it's now a radiochemical impurity in gallium-68. Not sure. So what is the effect of target purity and proton energy on shelf life? Again, you can look at the on the left-hand side, you have different enrichments of zinc, and then you can see the different impurities in the zinc. And you can look at if you take those and move those over onto the right-hand side, you can see that the shelf life, depending on the impurities and what the shelf life is and the grow-in of the unwanted products. There's a lot of work looking at solid versus liquid targets for gallium-68. The major difference is the dissolution of the target. You can see the two preparations there. It takes a little bit longer and a little bit more work to use a solid target, but you get significantly larger yields of gallium-68 on the solid target. So that tends to mitigate the shorter time frame for the liquid target. We not only make PET radiopharmaceuticals on cyclotrons, we also make single photon radionuclides, and you can see a number of them here. And I'll talk a little bit about ID123 and a little bit, no, I won't talk about germanium-68, I don't think. So I-123 is a very interesting radioisotope for nuclear medicine. I think it's because of the expense we don't have as many iodine-123 radiopharmaceuticals as I think we should have. And it's too bad that we don't have that. We can make it on cyclotrons, but the energy required is a little bit, or I should say medical cyclotrons. The energy is a little bit low on most medical cyclotrons that are sitting around at 16 MeV, and you need probably a 30 MeV to make a good yield. 24 MeV will make a not a bad yield. What I like about the iodine-123 reaction is they start out with the xenon target, and actually, I guess that's a slide following this one. This slide is very similar to the gallium target that I was showing you, and again, depending on the target, you see the different tellurium targets that we're using. And if you look on the left and you look on the right on those two cross sections diagrams, you can see how the how important the energy is, especially on the right-hand target for making iodine-123 and iodine-124. And you can see the narrow range here where you have all these different isotopes in there, and this is really where you want to irradiate and keep the different isotopes lower and get the other one out so you don't have as much grow in. So these are the old mechanisms for making iodine-123, but the mechanism for making iodine-123 now that you guys use is, I think, the most interesting one. Is it's actually a combination cyclotron production generator system where you irradiate xenon-124, you make cesium-123, and you have a gas that you irradiate. It makes a solid that that is radioactive. That decays to xenon-123, which you then isolate, and you can get the iodine-123, so it decays away. So your targets sit on one side and your products sit on the other side, decaying away. So it's actually quite a neat generator system, but it's not one that you can sit in your radiopharmacy. You got to have a cyclotron as part of it. I put this one in because Svetlana is going to talk about therapy, and actinium-225 over the last 10 years has become an interesting radiotherapeutic, and there's not, the supply of actinium is actually very, very limited. It's got a very the thorium parent has a very, very long half-life, and there's only a few places that are capable of making it and isolating it. And the estimated total annual capacity is around 63 gigabecks, and which is not a whole pile of actinium. However, it actually can be produced on a medical cyclotron using a radium-226 target and a P2N reaction. And you can see on the bottom here that, whoops, there we go. There's a blank button which I hit instead of the little red dot button. Anyway, if you look at this, you can see the energy is right within your medical cyclotron range, and you're very close to the peak level of making actinium. And because you only use actinium in microcurie or amounts, you probably can make enough on a medical cyclotron. The caveat is that the chemistry is exceedingly complex, and it can be done, but it's not for the faint of heart. If you look at this bottom chart here, you'll see that the chain of all of these radioisotopes, when you get into the very, very high weight ones, the chemistry becomes very, very difficult, and you're actually not working with one element. You're actually working with a number all at the same time, and you're separating them out. And I've actually never done any of that work, and I admire anybody who can. Okay, radionuclide generators. I'm going to talk a little. If you thought the rest of that was maybe a little bit superfluous for what you need to know, this might be even a little bit further down that realm. But I think it's interesting for you guys to know things about the radionuclide generators. And the reason I'm going to talk about stuff that you won't ever see and you probably won't hear much about, but I want you to know that it's there and it's being used, especially for the therapeutics that are coming out and the generators that are coming out. And I'll talk about 4 generators later on. And all of the radionuclides that are made for those, that are produced for those generators, are actually separated by these esoteric techniques. So I think maybe just seeing that, I won't elaborate too long on them, but just seeing that might be helpful. Humphrey's going to talk about the technetium molybdenum generator and all of the things that go along with that. So I'll just say that radionuclide generators rely on the formation of a desired radionuclide through decay of another one. Pretty straightforward, but that's a concept that I think pushed nuclear medicine to where it is today. And they rely on the easy separation of these 2 radionuclides. So what are the ideal characteristics of a radionuclide generator? Technically, you must have high separation efficiency. You can't have impurities, obviously, so you need a high radiochemical purity. You need a high radiochemical purity, high radionuclidic purity, high chemical purity, and high elution yield. And those are mighty stiff goals. Not only do you need to have really good efficiency, etc., it must be rapid and it must be simple. So when you put all those together, you can see why it took a relatively long time to produce the generators that we have today. And to show you that, you need to have the ability of the parent radionuclide, hence the Moly-99 situation that we're looking at, and it must be easily transported, so it can't be something that needs to sit in a van and be lifted onto your radiopharmacy in a forklift, which some of the ones that we'll look at later would require. So separation techniques, this is really what I was talking about, the different esoteric things that I'll talk about briefly, is there's many different ways of separating radioisotopes. All of them are used for the isotopes that get to you either in the generators or in those little vials. So the difference in physical state, you can either sublime or thermal chromatography. Sublimation is one of the ways that ID-131 gets to you from the tellurium target. Gel generators, that's just a chromatography system, but you trap the radionuclide in the column before you elute it. Differences in chemical properties, solvent extraction, we'll talk about that in a second. Solvent extraction is used in some of the strontium yttrium generator for yttrium therapy. And chromatography, that's the one that everybody tries to set up generators to use because that's the fastest and the simplest and the easiest way to go. So sublimation generators, just quickly, one thing I'll say is that all of these techniques have been used to separate moly and or technetium from the moly. And so all of these examples will be using molybdenum, but they can be used for all the other radioisotopes that we've mentioned we're looking at. Mostly for long-lived, but it can be used for short-lived as well. So the advantages of sublimation is you can use very low specific activity Moly-99. So it was generally started out to be used for Moly-98 reactions. It can be scaled up to be very high, very large scale, and the technetium coming from it is very, very high purity. The technical challenges are that the apparatus is very complex, high temperatures and volatile products, so you need skilled workmen and you need a appropriate facility, and you get relatively low yields depending on what your starting mass is, because you need to remove the technetium from the moly, and the moly, if you have a really large mass, it can be trapped actually in the mass even though it's available. These are just 2 units that show you how they work very, very simply. If you look on the right-hand side, you have a little oven, you have the things for the material, that's your moly sits in there. You heat it up, you cool it on the top, and you just literally, the technetium, which is a solid in the matrix, turns into a gas and is trapped on the little column there. And then you just wash that with saline, and there's your technetium. A gel generator. Essentially, what you do is you make your product, you dissolve it in, and then you dissolve your target material after you've made your product, and then you precipitate it, and then turn the precipitate into a column, and then you elute the technetium from your column. The drawbacks is that it's very cumbersome, very complex, high manufacturing costs, and pose significant potential safety risks. And again, the half-lives of moly are relatively short, and so using these systems, you're doing this all the time. If you're using a 10-year product, then you can set up a column and take your time, and you don't have to worry about that. So these things tend to be used for longer-lived products itself. And this is just a gel column system, and if you look at it, it almost looks like a regular generator, and it is, except it's significantly larger and a bit more cumbersome to put together. A solvent extraction generator. I bring this up for two reasons. Firstly, when I moved to Winnipeg, this is what we did. We actually had these not so little extraction systems, and we would get moly almost every day from Nordion, and we would pop it into this extraction system, and then every morning we would elute it. And it was actually an eye-opener for me because I'd only seen generators before, but we did that for a long time because it was cheap. And then Nordion started selling pure moly more expensively than we could buy generators. So we couldn't quite figure that out, but we stopped doing this and started buying generators. So there's a history lesson for you. So essentially, the other reason though I bring this up is that this was one of the separation systems that was looked at by the Saskatoon group for processing their very low specific activity moly 99 produced through the gamma reaction on moly 100. And the good thing about this system is that it actually works very, very well low specific activity. And I won't go through the mechanism on how the extraction system works, but you can take a look at that little chart below later on and see how that works. So I won't go through the. Okay, lastly, we have column radionuclide generators, and Humphrey will talk about this, but essentially my feeling is, and I mentioned it more than that before, was that if Tucker, Green, and Richards developed this generator in the 1950s, right at the same time as the Anger camera was being developed, and the two just married each other, and so the nuclear medicine was born. Now, these other generators, there's a whole pile you can see that are very useful. I've circled a couple in red. We'll go through them really, really quickly. The first one, of course, is the germanium gallium 68 generator. The advantages and disadvantages of the generators is the biggest disadvantage right now about the gallium generator is they're still small. I think there's a new generator out that can make about a curie of germanium on it. Because they're long-lived compared to the moly generators, all of these other generators have significant problems with radiation damage to the column, decreasing elution yields, not only through decay of the parent, but because of the trapping of the product on the column, excuse me, etc. I need to get a little more vodka. A lot of what I have on this slide is actually kind of historical, and the newer generators have worked very hard on the breakthrough problems and things. So you see essentially you're getting pretty good yields of gallium, 75 to 80%. Shelf life is still around 9 to 12 months. Many of the generators you can actually elute for 12 months, but there's not a whole lot of gallium left there anymore. So even though you can use them that long, it's probably not very useful at that. The different eluates that were there with the different manufacturers, etc. So anyway, the gallium generator is becoming very important, and I think that more and more people are using them. It'll be interesting to see if cyclotron production of gallium becomes competitive, or whether the generators will win out. I think part of it is most people don't have enough cyclotron time to make fluorine for FDG, or many places, and so throwing another couple of isotopes in there might not be useful or doable, depending on the usage of the cyclotron. I won't go too much detail in this. This is just your the secular equilibrium and how the generators work. These are again a little bit historical, showing the different types of generator manufacturers. There's new generators coming out. This is a milestones. I always like to talk about history, but I won't today. I'll just leave that for you to look at. And this one is just looks at the different generator systems, the type of column, the type of eluate, etc. That was looked at in the production of the generators. And again, it's kind of historical, but it shows all the different work that was put into it. And I think what to remember on all of these things is that the chemistry is important at the end, and things like gallium and yttrium that we'll be talking about, it has to come out, and you have to be able to use that further on. The rubidium generator that we'll talk about next is you use it directly as a chloride. So again, it's important that the final product is usable, but in this case, there's no chemistry involved. It's just injected directly into the patients. A lot of work went into the strontium-82 rubidium generator, and I still think that they're probably underutilized. The problem and the advantage of the strontium generators, it's got a long half-life of 25 days, but it's considering the cost in the system itself, the 25 days is a little bit limiting. In that you don't have the generator for as long as maybe you would like to have it to do all the patients that you need. But the chemistry is pretty straightforward, and this is the little picture on the side here is the Canadian entrant into the field, and it's the RubyFill, and it was authorized quite a while ago. I don't even remember anymore when it was authorized, but what, 2019 or something like that, maybe 2020, maybe 2018, can't remember. Anyway, it's been around a long time, so that's a good thing. The one thing is strontium-82 is there's a bit of a shortage of the strontium-82, and that's a bit of a hassle. So here's just an insert again. You guys can take a look at that. If you've used it already, you've looked at that insert. The strontium-90 yttrium. I thought this generator would be more widespread, but yttrium hasn't. The use of yttrium hasn't really moved forward as much. I think the advent of lutetium and maybe actinium, the yttrium has become less important. So you don't really see too many yttrium generators. One of the problems actually with the yttrium generator is that the strontium-90 is source is not a problem. There's lots of strontium-90 in the world, but the generators are actually relatively complex, and there hasn't been much commercial interest in making them easier to use. So it's sort of a catch-22. If nobody's using it, then people don't put money into developing a better generator. And if there's not a better generator, nobody wants to use it. So, and also the yttrium's got a long enough half-life that you can ship it quite a ways as well. So the interesting thing about the yttrium is that it's a liquid extraction system, and that's relatively rare now. Almost all generators that you see are column generators. And lastly, a tungsten rhenium 188. This is another isotope that I really thought would move forward in therapy, but hasn't seemed to do anything at all. These generators, they have a nice half-life for the tungsten. The rhenium has a relatively nice half-life, and the generators actually work relatively well. The chemistry is touted. Tungsten is an analog of molybdenum and rhenium of technetium, so the chemistries are supposed to be the same. They're not quite the same. Tungsten chemistry or rhenium chemistry for labeling is a little bit more difficult, but in the end, you can get the same products as you can make technetium products. So I'm surprised in some ways that the rhenium generator hasn't moved forward. Radionuclidic purity. Talk a little bit about that. That's the important part about the production of radioisotopes, is that you can see how complex some of the production techniques are on the cyclotron and the reactor. And so this is not your standard TLC thing of a radiopharmaceutical because you know it's going to be good. This is something that you really have to look at. I just bring this up because I thought this was so interesting when a group that I was involved in was trying to make technetium-99 by bombarding molybdenum 100 with a cyclotron. And you can see on the left you have a natural moly, and you can see the different radioisotopes. And then if you bombard enriched moly 100, you see that you really essentially only have technetium-99M. So your choice of your target material is pretty important. That's not the only thing, though, that's important in producing technetium on a target. This one I think took me a while to wrap my head around, in that the purity of your moly is not apparent. So I've written here that you have two batches, moly number 1 and moly number 2. Moly number 1 has an apparent moly 100 purity of 99.27, so that's the one you would buy. Batch number 2 has a apparent moly 100 impurity of 97.39, so that one's nowhere near as good. Until you realize that the major impurity in the moly 100 is moly 98, and it doesn't make any radionuclides that you don't like. However, the moly 100 has relatively high impurities of the other nuclides, or the other isotopes, I should say, and they all make things that you don't like, and they're significantly higher. So in the end, you know, the devil's in the details. And this is just another slide to show the different the different isotopes and their dependence on the energies. So you have different purities of target material, different energies of impinging, and then the amount of unwanted radionuclide impurities that you get, and the consequences of this choosing the wrong target material are increased patient dose, decreased shelf life, and potentially poor imaging quality. Thank you.
Okay, thank you so much.
Congratulate you all for not falling asleep. I have kind of a droning voice, so I apologize for that.
Thank you so much, Doug. That was very informative.
What's that?
That was very informative. Thank you so much, Doug. I think we're over the time, as you predicted.
As predicted, yeah, I apologize.
So, no, it's okay. I don't see any questions online, so I would suggest to go to break and come back at 10:30 for Esther's talk. Is that okay?
That sounds good to me. Thanks, Mahela. The interesting thing.
Okay, then I'll see you all back at 10:30.